Hi there. Welcome to The Preventable, the podcast giving you a seat at the table with conversations about the intersection of alcohol, drugs, and mental health in everyday lives. Take a seat and join us.
Welcome to The Preventable. Before we get started today, I want to make sure and give a big thanks to Hubbard Radio for allowing us to use their space to record our conversations to share with all of you. Today, I have with me Adam McBride, Prevent+Ed's Director of Advocacy. Hi, Adam.
Hi, Jenny.
How are you doing today?
I couldn't be better. How are you?
I'm doing all right. The sun is shining. It's a nice day. It's a good day to be talking about advocacy. So you have been Prevent+Ed's Director of Advocacy for how long now?
Just short of 2 years.
Almost 2 years. And you are also Prevent+Ed's first Director of Advocacy.
This is true.
This is true, yes. So Adam joined in July of 24 as Prevent+Ed's Director of Advocacy, knowing that advocacy is part of our mission, part of the work that we do. So what does it mean to be a Director of Advocacy?
Oh, that's a great question.
That's a big question,
that's
right?
That's a really big question. Well, I think that first and foremost, it's to be a competent spokesperson on issues that the agency really focuses on and is part of your core, your mission. Mm-hmm. And what it is that you aim to do in the St. Louis and surrounding area. And so being informed, being knowledgeable, being able to articulate why things are good public health policy or why prevention education really matters, I think is really all part of advocacy. But also on top of that, when you say like, well, but to do what with that? You can really talk about how you engage industry stakeholders, government stakeholders, people that can effectuate real change. This is one of the things that I love about government is if you say, like, I see this problem, how can we address it?
Yeah.
What are ways that we can fix it? The clearest line is for a blanket law to be passed, or for legislators to consider ways to tackle that problem through regulation and through legislation, because then it applies everywhere, and you could sort of have that date of enactment. And that's when the full change really comes around. Absolutely.
And I know that, since you've joined as our Director of Advocacy and even, in the work over the years of Prevent+Ed, there's lots of opportunities that we've been able to influence different types of legislation and different things we've been following. Everything from, of course, budgets and financial support, but then also issues, all the way back to clean indoor air laws or laws around restrictions to prevent, manufacturing of methamphetamine. So there's a lot of policies related to substance use, but one that we particularly have been watching and paying close attention to at both the local, state, and federal level in the last couple of years is really around intoxicating cannabinoids. That's a mouthful. Intoxicating cannabinoids. Yep. Like, try to say that 10 times fast, right? No. Adam says no, he's not going to do that. But tell us more about what are intoxicating cannabinoids.
So I think it's important to have just a little bit of background. In 2018, in the federal farm bill, they changed the way they defined hemp and cannabis, and it was all at the point of cultivation. And so then after that, what happens? And it created what they call the Farm Bill loophole. Mm-hmm. And in that loophole, it was unrestricted what you could do with the plant after it was harvested. And so just like happens in the world, chemists and other scientists and other folks that they learn how to gain more from what was previously less.
Yeah.
And it created this whole new class of completely unregulated, some might say operated in a gray space of intoxicating substances that weren't by definition any longer marijuana, but so like Delta 8, Delta 10, the list goes on and on. I'm not even going to try to name them all. Mm-hmm. But they were these chemically derived products that created that same intoxicating effect on whoever consumed it. And then they weren't tested, they weren't regulated, they weren't anything. And so we started to see them proliferate since 2018, and they've been sold pretty much anywhere they wanted to be sold because we don't have a framework around where they can be, like point of sale. There was no framework. There was no legal.
Yeah, so when we say that they're not regulated, we know they're not regulated in the way that they're sold, so they can be sold anywhere. But that also means they're not regulated in kind of, I'll call it quality control. So, I mean, do we really know when something might be sold at a place that's named Delta 8? What does that even mean? What really is that product?
Yeah, so recreational cannabis in Missouri has a rigorous framework that it must operate within, and that includes all the testing to make sure the product is what it is purported to be and meets state standards. What we're talking about when we say unregulated, we're also talking about untested. So these products don't have any of that same system in place to make sure that when you purchase one, say you're even knowingly purchasing one, that you know what's actually in the product.
Yeah.
In addition to it, it also, when we say unregulated and untested and gray areas, there were no packaging standards that your traditional recreational marijuana has to follow as well, where it can't look enticing to kids. It couldn't be in colorful packaging. It couldn't mimic, traditional, say, candies or other products that, are designed like by a packaged nature. And I'm not a design psychologist, but I know that there are things around bright colors and fonts used and all those things that can make things and items more appealing to you. It also didn't have any of those restrictions around it either. And so I think most of the listeners have probably seen or seen advertisements or websites or saw them themselves on convenience store or smoke shop shelves. Honestly, if you don't look really close, you would never know that it wasn't, say, like a bag of your traditional candy that you might buy all the time.
Right. And just so that lack of regulation or that non-existence of regulation, I was just thinking about that. If something looks very much like a candy we might buy otherwise, I'm assuming because there's no regulation, it's much harder to hold those people accountable for any even type of trademark infringement or, other things like that because it's unregulated. So there's probably not a nice source tracking of where it came from and who's producing it anyway.
Well, and at the scale that they're available, good luck enforcing any of that anyway. It would be difficult to do.
Absolutely. So these were just kind of widely available. These intoxicating products that give people a high were available in gas stations and different convenience stores or smoke shops. Many look like popular candies or other products, and pretty much anyone could purchase them.
That's correct.
Yeah.
It's really hard not to use specific brand names, which I'm trying clearly to avoid, and I think it makes it a little more difficult to kind of convey. But I like the way you said it, the popular name brands. They really could be sold anywhere.
Anywhere.
Yeah, and, I know that there are some retailers that, would put them in more protected areas of the store, but there were also plenty that did not. And so they were accessible to young people, children, kids, anybody could just grab it off the shelf. And if you didn't really look for the fine print, that there might be a small word that says medicated.
Right. Or
maybe the I is now an E, but the script makes it really kind of hard to tell in the name brand or the brand of the product. I got to tell you, I've always used the analogy, and always scared me is, we're all busy people. I have a young child, and say if we were in one of these convenience stores and I'm on the phone, whether it's for work or pleasure, I'm a little distracted. Hey, can I have these? Throw them on the counter, kid. Next thing I know, 15 minutes later, we're driving home, and maybe he's not acting properly, or acting like himself in the back seat. Now I'm left wondering what just happened, and we see that, and the data supports that. Poison Control Center calls have skyrocketed. Right. Emergency room visits are on the rise. Urgent care visits, and all of that's a healthcare cost burden to all of us in the systems that we all participate in. But more than just the costs associated, that's ancillary to the health and safety of the unsuspecting consumer, let's call them, whether it's a youth or an adult. I mean, let's be honest, it could happen to anybody, including the elderly. I thought maybe they were just buying a name brand candy and
then have a weird reaction to it.
Yeah, it doesn't discriminate who ingests it.
And how it's going to respond. That's right. So how do we regulate these, or how have we started to make some efforts to put a little bumpers around these products and make sure that we have a little more education and boundaries around how they're used and who can use them?
That's a great question. I might have an answer for you. So when we started last December as Prevent+Ed, we developed sort of a 4-core policy position paper, an advocacy tool, if you will, to highlight the need in 4 specific areas that we thought might be doable, in the next 12 months. And so I think a lot of your listeners may or may not be aware, but our state legislature runs from January to the middle of May. Like, we are 3 days away from them concluding the 2026 regular session. And it's an opportunity, as we discussed earlier, for legislators to maybe get keen on the idea of helping to fix a problem. And, if they believe what you believe, we believe this is a problem, on a number of different levels. And so we developed this position paper, and one of those 4 core pillars for 2026 was intoxicating cannabinoids. But as Prevent+Ed, we really made sure that our position came first and foremost from protecting youth. So we're talking about age gating, we're talking about packaging, labeling, we're talking about some standards that will help make them less enticing to youth. And then we wrap that in what our general mission is around education and how, these products, legal or in operating in a gray space, they're not healthy for our bodies, particularly the undeveloped or fully developed mind yet. And so not just us, but as other concerned folks in the public health space and other stakeholders that we discussed, and looping everyone together as part of advocacy work, there was a real push this legislative session by some concerned legislators that agreed with the positions that us and others had taken, that this was something that needed to be addressed, and probably was almost a day late and a dollar short, because this has been going on since 2018. And it just gets worse and worse each year. And so happy to report that House Bill 2641 has passed both chambers, and it's been signed by the governor. And so now that is in law, most laws in Missouri go into effect August of each year. This one has an effective date of November 12th for the core provisions of what we're really discussing for this podcast today. And that November 12th wasn't just picked out of the hat. Last November, so it would be 1 year to the date of, Congress passed a CR that had a provision in it.
In Congress, we mean at the federal level.
At the federal level, yeah, thank you. At the federal level, they passed a funding CR that completely had a provision that completely made illegal all of these products.
Okay. Completely
shut down this $1 billion+ industry in 1 year. I mean, exactly 12 months to the date. And so that falls on November 12th of 2026. And so legislators used that date because it was a sort of a staple that had already been set for these products by Congress, by the United States government, essentially. To say, like, you guys have been preparing for this date, let's give you until that date, but then here's what's going to happen on that date. And there's sort of a couple key triggers that take place. So on November 12th, all of these products, regardless what, all of the solids and vapable products that are embedded with this synthetic or chemically, derived intoxicating compounds will only be able to be sold in licensed dispensaries, just like recreational marijuana.
Okay.
Now, if Congress maintains the outright ban that's currently what's slated to go into effect at the federal level, then nationwide, all of these substances can't be sold at all.
Period. It's over.
It's over.
Well, I mean, I'm sure there's still a black market for them, but not in the way that they're sold today.
Not, I'll air quote, legally, right? Legally, or gray legally. That's correct. So that'd be a nationwide ban on all these. That's what's set to go into effect as we speak on November the 12th of this year, nationwide. Now, if Congress says, hey, let's give them more time, so we're going to kick the can down the road, so we're not going to stay with the ban, we're not going to make them legal, like reverse course and make them legal, by which case, even if they did make them legal, completely reverse course, they can still only be sold in licensed dispensaries in Missouri anyway. Yeah. That's one of the positives that this law brings. But if they kick the can down the road, then they still are regulated to the same restrictions as our marijuana, our legal recreational cannabis here in Missouri, with the exception of one. There's a beverage loophole. So if they kick the can down the road and say, like, we're just going to hold the status quo for a little bit longer, then beverages would be carved out, still be THC. Beverages would still be able to be sold in like convenience stores and liquor stores. But the edibles, so the solids is the way it refers to them in legislation, and the vapables, the restrictions would still apply. Nice. So I think this is a great compromise. I don't really care for that word because I think it really kind of nets us what we want. From a policy standpoint, from where I sit, I wish that it had an emergency clause and went effective immediately. We've waited since 2018 to get here, so I guess a few more months is not an unreasonable, period of time to wait.
So essentially, whatever happens by mid-November in Missouri, edible and vaping products of these cannabinoids will only be able to be sold potentially in licensed cannabis facilities.
And subject to the same framework that recreational cannabis has.
And that would be the same taxes, the same, all of the testing and labeling. And
prescribes all of that. Yeah, essentially, they're labeling these previously unregulated gray area products. They're categorizing them as cannabis and will be treated as such within our constitutional framework.
So we know that this will go into effect mid-November regardless. Was there anything in the legislation, though, to help with, I'll call it the enforcement side? How are we just going to kind of flip this, have it switch right away in November? And, what if merchants don't? Or what part of enforcement or accountability is written into the legislation?
Yeah, it's a great question. So what I can report is that was the beauty and the genius behind essentially rolling these products within the constitutional framework for recreational marijuana that the voters had approved years ago, where that enforcement mechanism and the folks that are tasked with enforcement and the people, like, none of that has to change. And the fact that we have moved all these products within the same dispensaries and made them only available in those furthers that enforcement end. And so we've added the number of products, but we haven't really changed the framework and how it's enforced. And I think that's a really important distinction for this bill. And I think that's why the drafters of the bill wrote it this way, is so that we didn't have to go find new money to create new enforcement mechanisms. We already had that in existence, and we have a funded structure that is there to take care of that.
And communities, and whether it's prevention groups or coalitions, are the people that are already familiar with that structure or local enforcement in that way. So this is not something new that people will have to figure out. It's just being rolled into something that we're already familiar with and already exists.
Continuity of enforcement.
Love it.
Yes.
Love it. I know, before we wrap up here, I do want to acknowledge that I know that we've also worked with some more localized government, whether that's at a county or city level, to be able to look at some of these ordinances in the past too. And I know that, there's been some, I won't say pushback around the spirit of what the legislation is, just how much it can really be impactful at such a localized level. So, it was some voices really sharing that, well, this should be done at a statewide level, or this should be done at a national level. So it's taken us a while to get to this point, but it isn't an issue that even local governments haven't wrestled with too in the past, right?
Spot on. You see a lot that some of the best ideas are developed at the local level because the folks that are elected, our servant leaders, are closer to their communities. The larger your district gets, sort of the more you get the forest and not the trees. And so I think that whether it's a county councilman or an alderman or a city councilman, it doesn't really matter what that structure, wherever you're at in that chain of local to the federal level.
Right.
The higher you go, the larger the district. And so I think that's the great point about advocacy, though, is I have this, and I don't even know who to attribute it to. Certainly not me. I picked it up somewhere else. But if not you, then who?
Mm-hmm, mm-hmm.
And I love that in so many ways, because not only is it applicable in so many situations, but what we find in advocacy, a lot of people think that somebody else is doing something.
Yeah.
Somebody else has said it. Somebody else has sent that note or that email. And I said, but what hurts to do it yourself too? So if not you, then who?
Mm-hmm.
It really just says that if you think it's important enough to say, you should say it.
Mm-hmm.
Right?
Absolutely.
And I think that you get a lot more of that the closer you are, to the problems, because you have more time in district, or, you have more folks that are comfortable maybe when you're a city council person talking to you than when you're a United States Senator. It feels different to most folks.
Feels different. Absolutely. Well, thank you, Adam. Thanks for joining me today. But more importantly, thank you for loving advocacy and policy work, and always being willing to dig in and get through the nuance and the minutia of it to be able to explain it to other people, because I think part of that is it sometimes can be overwhelming when you're looking at the legalese of bills and legislation and trying to figure out, what does this mean? So I know I've really benefited, and Prevent+Ed has benefited from having you on the team to be able to, be our interpreter in some of that too. So thank you. Thank you for that.
Well, I appreciate the invitation. I hope that, your listeners get something out of today that maybe they didn't have before. But I appreciate the work that I get to take part of every day.
Absolutely.
It's different. Everybody has good days and they have less than good days. But when you get to work in a space that is full of topics and opportunities that you deeply care about, but it makes all of it just better, know. And so I appreciate the opportunities.
Yeah. Well, if anyone listening would like to talk more policy and advocacy with Adam, or have any other thoughts about priorities for Prevent+Ed, you can find Adam's contact information on our website at prevented.org. Thank you all for listening. If you've liked what you've heard and you want to hear more, be sure to subscribe anywhere that you access your podcast. We'll see you next time on The Preventable.
Thanks for joining us at The Preventable, brought to you ad-free by Prevent+Ed. Prevent+Ed works to reduce or prevent the harms of alcohol and other drug use through education, intervention, and advocacy. Please visit their website at prevented.org. Like what you heard? Rate, review, and subscribe to stay up to date with what we are serving on The Preventable.